Welcome to the Courting Happiness podcast. This is a space where self-care becomes part of your day. A space where you learn evidence-based strategies to help your life, share it with those you love, and cultivate well-being at work. I'm your host, Dr. Kortni Alston. I'm a former news director, television reporter turned happiness scholar, TEDx speaker, and transformational trainer. I also understand hardships. While working my dream job in television, I lived a nightmare suddenly becoming a young widow after 86 days of marriage. I became committed to learning more about resilience, healing, and happiness. This is how I discovered my area of research, which is positive psychology. Now I'm living my calling of training individuals and organizations on happiness. And my new chapter begins with being happily engaged. The Courting and Courting Happiness is about a true courtship. I like to say commitment with happiness. The K in courting stands for the vulnerability of sharing my story, inspirational interviews with phenomenal people, the infusion of positive psychology, and so much more. You'll learn how to commit to your well-being one episode at a time. I hope you subscribe and share. So, are you ready? Let's get started. Welcome to episode 84. I'm Dr. Kortni Alston. I am so happy that you're here. Thank you so much for listening. Well, May is Mental Health Awareness Month here in the United States, and I feel it's an important episode to discuss mental health awareness, especially in the United States right now because of recent headlines. And for those of you who are listening to Courting Happiness around the world, I'm sure you've heard this news that has happened here in the United States. And the headlines has been about country music singer Naomi Judd. On April 30th, it was reported that Naomi died. She was 76 years old. Her daughters, Winona and Ashley Judd, shared this in a statement on Instagram, which is actually from the Judd Official, which is the official Judd page on Instagram. I actually have it pulled up right now, and I wanted to share that with you. And I am going to read it verbatim. So, quote, "Today we sisters experienced a tragedy. We lost our beautiful mother to the disease of mental illness. We are shattered. We are navigating profound grief and know that as we loved her, she was loved by her public. We are in unknown territory. Winona and Ashley." Such, when I initially read this, and when I got the news start coming down on my phone and all throughout my Facebook feed, I just was heartbroken. And I'm still heartbroken. I mean, I am a huge fan of the Judds, and I wrote a post recently once I found out the news, and I was talking about how much I just, admire all things Judd and all things Judds, I should say. I said it singular, but I mean plural, and all three of them. But the interesting part is that I spent that weekend really honoring Naomi and listening to all my favorite Judd songs. And also, I listened to a little bit of her audiobook. And I just thought about when I initially posted about her death, how much I really admire how she talked and had the courage to share her journey as it relates to mental health and mental illness. And you can read more about her story in her book. And so still, as you can hear by the sound of my voice, I'm still shocked by her loss. But I thought the statement that Winona and Ashley shared with the world in regards to, we lost our beautiful mother to the disease of mental illness. Now, recently, People magazine has reported that Naomi died by suicide. And other news organizations at this point, during the airing of this podcast, are really reporting off of some of the information in regards to People Magazine. I haven't found any other news organization outside of People Magazine right now. Of course, this information is going to look differently in maybe days and weeks and so forth. But the journalist in me was looking for other news organizations. Right now, as I record this podcast episode, People Magazine is the source that is the news organization, I should say, that is reporting Naomi died by suicide. My heart breaks. It breaks concerning the death of Naomi. And as I mentioned in my recent post, when I heard about her death, I just spent the weekend honoring her and her talent and her courage in terms of sharing her mental health journey with the world. And so I want to continue to talk about mental health, and especially since it's Mental Health Awareness Month here in the United States. But I want to share this because Courting Happiness podcast, we have a global audience. And so this is a global conversation. And I'm going to share a lot of information from an organization here in the United States called the National Alliance of Mental Illness, which is known as NAMI. And I'm going to share a lot of information as relates to that organization. But I will be ending this podcast with information globally, and where you can find that information on our website. So according to the National Alliance of Mental Illness, more than 12 million Americans, this is, I believe, data from 2021 or 2020, more than 12 million Americans have had thoughts of suicide. And in addition, 1 out of 5 adults have experienced mental illness. Now, today, I want to spend this episode focused on the National Alliance on Mental Health, again, also known as NAMI, in terms of the signs and how to get help. So this information comes from the National Alliance of Mental Health. And as I am sitting here, I'm just going through some information, just wanting to confirm certain information as I'm sitting here talking with you about this, especially as it relates to some of that data I just shared. That data was actually 2020. So I just want to make sure I was accurate as it relates to that. That was 2020 data. And again, this is the National Alliance on Mental Health, National Alliance on Mental Health. And so this is information that they've provided to be able to spread awareness as it relates to mental health. And they talk about this on their website, which you can certainly find on drkortnialston.com. And they share in terms of trying to tell the difference between what is expected behaviors are and what might be signs of mental illness aren't always easy or isn't always easy. There's no easy test they share that can let someone know if there is mental illness or if actions that are thoughts that might be typical behaviors of a person are a result of a physical illness. And this is coming directly, again, from the National Alliance on Mental Illness here in the United States. They say each illness has its own symptoms, but common signs of mental illness in adults and adolescents can include the following. They say excessive worrying or fear, feeling excessively sad or low, confused thinking or problems concentrating and learning, extreme mood changes, including uncontrollable highs or feelings of euphoria, prolonged or strong feelings of irritability or anger, avoiding friends and social activities, difficulties understanding or relating to other people, changes in sleep habits or feeling tired and low energy, changes in eating habits such as increased hunger or lack of appetite, changes in sex drive, difficulty perceiving reality, delusions or hallucinations in which a person experiences and senses things that don't exist in objective reality. Inability to perceive changes in one's own feelings, behavior, or personality. They mention, quote, lack of insight. Ailments they mention, such as headaches or stomach aches, or, and ongoing aches and pains. They also mention thinking about suicide. Inability to carry out daily activities or handle daily problems and stress. An intense fear of weight gain or concern with appearance. Mental health conditions can also begin to develop in young children. And because they're still learning, they mention, on how to identify and talk about thoughts and emotions, their most obvious symptoms are behavioral. Symptoms in children may include the following: changes in school performance, excessive worry or anxiety, for instance, fighting to avoid bed or school, hyperactive behavior, frequent nightmares, frequent disobedience or aggression, frequent temper tantrums. One of the things one of many things I should point out that the National Alliance on Mental Illness shares is where to get help. They talk about, they give great information in regards to the research and also where to go to get help. And we're going to talk about where you can get help. And they mentioned this: don't be afraid to reach out if you or someone you know needs help. And I think that's important to repeat. Don't be afraid to reach out if you or someone you know needs help. Learning all you can about mental health is an important first step. They also add, reach out to your health insurance primary care doctor or state, county mental health authority for more resources. You can contact the NAMI HelpLine to find out what services and supports are available in your community. And if you know someone who needs help now, you should immediately call the National Suicide Prevention Lifeline, which is 1-800-273-8255. That's 1-800-273-8255, or call 911. You can also go to our website at drcourtneyalston.com/podcast/episode 84 to find out about what resources are out there globally, like the international resources, like in terms of the International Association for Suicide Prevention, and Befrienders worldwide also provide contact information for crisis centers around the world. Please visit our website in terms of learning more about the National Alliance on Mental Illness, also those global resources, and please share it. Share it in your community. Share it with someone that you believe also needs to hear this information. But please make sure that you spend time on the website at drcourtneyalston.com and learn more about these incredible organizations like the National Alliance on Mental Illness, as well as the International Association for Suicide Prevention and Befrienders worldwide. Thank you so much for listening. Let's continue this conversation online. Email us at podcast@drcourtneyalston.com. That's podcast@drcourtneyalston courtinghappiness.com. Join us on Instagram at Courting Happiness. Don't forget, that's courting with a K. Also, I hope you join our private Facebook community. You can find us at Courting Happiness Podcast Community. Our private Facebook group is a safe haven to share, meet more people looking to build positive relationships, focus on well-being, and create a happier life. Now, are you ready to spread happiness? We hope you subscribe and share this podcast with your family, friends, coworkers, and all the important people in your world. We release a new episode every Thursday. Congratulations on your continued commitment to your courting happiness journey. Thank you so much for listening. We want you to be well, be happier, and be kinder to yourself. We can't wait to see you next week.